Technical Veterinary Learning Channel presents fourth part of equine influenza lecture, which includes laboratory diagnosis, treatment, and control of the disease. This presents by Ahmed Mamdouh Al-Sharif, Professor of Infectious Diseases, Department of Veterinary Medicine, Faculty of Veterinary Medicine, Bani Suef University, Egypt. Laboratory diagnosis of equine influenza infectious disease, beginning by the right ways of samples collection as followings. Nasal swabs collection from nose of infected animals. Going deep gently and take nasopharyngeal swabs from diseased animals. Bird blood samples were collected from diseased horses. The first samples used for isolation of the virus. The second one, we will detect the titer of immunity in the sera of diseased animals. Equine influenza virus identification by fluorescent antibody technique, where the picture on the left side showing illuminating green particles with positive viruses. Equine antisera is specific to recent strains in the last outbreaks throughout the world will be produced and used for further antigenic characterization. Recent virus strain isolated, including suitable vaccine candidates for clade 1 and clade 2, are available now from the OIE organization reference laboratories throughout the world. Serological tests by ELISA, complement fixation test, and serum neutralization tests, and these two charts explain how to make them. Application of PCR identification on nasopharyngeal swabs is the most accurate and specific test for identification and characterization of the infectious virus. Viruses of H3N8, H3N8, H1N1, and CH3N2 appear here by using of PCR nasopharyngeal swabs, which is the most accurate and specific tests for identification of different types of viruses and bacteria in infectious diseases of animals. Equine influenza disease have to be differentiated from equine viral rhinopneumonitis, equine viral arthritis, African horse sickness, strangles, glanders, lungworm infestation. Symptomatic treatment of equine influenza will be followed. Antibacterials and antibiotics are indicated when fever persists beyond 3 to 4 days or when purulent nasal discharge or signs of pneumonia is present. They are such sulfonamides, procaine penicillin, gentamicin, chloramphenicol, and so on. Diseased horses in severe cases with equine influenza have to have fluid therapy. Maintenance requirements are the adult horses are 50 ml per kilogram per day, for foals 75 to 100 ml per kilogram per day. Total fluid needed are multiplied body weight by kilogram in dehydration percent, and then keep going, estimate the losses. Fluid therapy applied by intrajugular injection of the fluids drop by drop at the first 20 minutes, then become in streams. The fourth step in the treatment of equine influenza diseased animals symptomatically are the application of non-steroidal anti-inflammatory drugs such as ketoprofen, tofeprofen, and so on. Rest and prevention of adust is a very important step in the treatment line. Minimizing complications of equine influenza through restricting exercises of diseased animals, controlling dust in the barns, providing superior ventilation in the barns, practicing good stable hygiene for all the farm. Control of equine influenza. The most important step in control of equine influenza is the application of quarantine by prevent entrance or coming out of equines from infected areas to other areas. During outbreaks of equine influenza, we will make isolation of the diseased equines from surroundings, optimal ventilation in their barns, prevent movement of horses between barns during disease occurrence, proper disinfection of tables, equipments, and transport vehicles. Vaccination of enzootic areas with equine influenza is an important by usage of inactivated vaccines, inactivated subunit vaccines. Most commercially available influenza vaccines are inactivated. Adjuvant vaccines are recommended primarily for intramuscular administration per 6 months. A recombinant canary pox vectored influenza vaccine has also been shown to be effective against influenza challenges. As the duration of protection provided by the current vaccines is limited, booster injection for at-risk adult horses should be administered every 6 months. Sedentary horses can be vaccinated annually. Foals should be vaccinated with a single modified live intranasal vaccine. According to the recommendations of OIE, foals take a series of 3 inactivated vaccines as the following. The beginning one at 6 months of age, booster vaccination within 3 to 6 weeks, and then again between 10 and 12 months of age. Broodmares should be vaccinated 4 to 6 weeks before foaling. The last recommendations elaborated by OIE in April 2019 are currently unchanged from those made each year since 2010, but said that vaccines should contain both clade 1 and clade 2 viruses of the Florida sublineage. Manufacturers producing vaccine for strictly national markets are encouraged to contact with reference laboratories. Selected viruses should induce responses which are immunologically relevant to the equine influenza viruses circulating nationally. Benefits of equine influenza vaccination. Benefits of vaccination. Unvaccinated horses will show 100% probability of disease transmission, while vaccinated one shows only 47%. Differentiation between vaccinated and infected horses through detection of hemagglutinin in vaccinated one, but hemagglutinin and neuraminidase genes are present in infected one. 50% of ratio of vaccine will be effective. Rest of respiratory infections will be followed soon. By making subscription to this channel, you can get the newest videos, clinical examinations of animals with different systems, as well as different lectures about infectious diseases of animals as soon as uploaded on YouTube. Goodbye.